Christina Rodriguez for the Axle Skeleton video. The cranial bones are the frontal, the parietal, that is on both sides, and then we have the occipital, which is the base of the skull. The external occipital pubescens, what is that for? That is actually the bump or underneath the head, just above the neck. If I was able to take the head off, you would see actually the hole, and that is what that is for. The external occipital protuberance, which can be easily palpated, is the big bump on the back of the skull. So then next we have the temporal mandibular joint, and that is actually this small area right here, closest to the ear. We have the mastoid process, which is actually in this vicinity here. We have the xyloid process, which is very close to the mastoid process. They're very close in proximity. Then we have the external acoustic meatus, which is right here. And then we have the squamous part, which is here. The internal view, we have the posterior partus of the temporal bone. What structures are housed within this part of the temporal bone, and it is the inner ear. I'm sorry, that would be upside down again, and that would be in this area down here. Then we would also have the internal acoustic meatus, and what passes through those openings, it's the cranial nerves 7 and 8. Then we have, moving on to the xiphoid, we have the external view, and that is the lateral and orbital parts, the greater wing, the superior orbital fissure, what passes through that opening, and that is the superior orbital fissure lies between the greater and lesser wings and forms a large triangle-shaped slit, which can be seen in the back of the orbit. Again, if I would take this off, you could see it up in here, this area. I did try to take the head off, and I was unable to remove it. It is a large triangular slit, which can be seen in the back of the orbit. The superior orbital fissure transmits cranial nerves 3, which is the oculomotor, 4, which is the triocular, and the ophthalmic branch, which is 5, which is the trimenal, and 6, the abducens. That is the xiphoid. The internal view. The lesser wing would be in this vicinity. The greater wing would be in this vicinity. The optical nerve, what passes through that opening, is the veins, and I really don't know. And then you have the cella turca, which structure sits in the fossa, and that is the pituitary gland. Then we have the ethmoid bone. I think this is one of the most interesting bones that we have in our body. The ethmoid bone, it is the crystal gallia, which is like the tip of this here in the bone. And what does that do? It separates the attachment site from the meninges that cover the brain. We have the cerebral plate, which is in this vicinity over here. It's a very tiny slit right here. And what passes through those holes are bundles of 8 axons. Moving on to the sutures. So we have the sutures. We have the coronal, which is the crown across. This is the frontal area, but that is the, it is this part here. Single front bone and 2 pairs of the perinatal bones. We have the sigmoid, the signal suture here, and that's the long line from the anterior to the posterior, and that connects the parietals and the frontal and the occipital as well. The lambdoid, and that is I think I messed that up. So this is the so then there's that part. And then the squamosal is the temple bone and the parietal bone. So that is the slit over here, the temple bone and the parietal bone. The facial bones, the facial bones. So we have the maxilla and the alveolar process, and that's the teeth. That's that's this area here, the maxilla. We have the nasal, which is on the sides of the nose here, the bridge of the nose. We have the zygomat, what 2 bones from the zygomat arch, that is the cheekbone here. These are the zygomats. The ethmoid, and it's the bone connected to the cheekbone, so that's the ethmoid right in here. We have the vomer. The vomer, what 2 bones form the bony nasal sternum. So the vomer is like deep inside here, and it's there. The internal nasal concha, what makes up those bones? That's going to be this vicinity in here. We have the superior, the middle, and the interior nasal concha. And that's all in that area there. And what do those bones do? They separate the nasal cavity into 2 bilateral and symmetrical anatomical caves. We have the mandible here, and now we're going to go over the places of the mandible. So we have the body of the mandible. We have the angle of the mandible. We have the ramus, which is here. And then we have the mandible condyle connecting to the skull, that's here. We have the mandible notch, which is here. And we have the Conrad process, and that is this. The vertebrae column. So we're pointing out the 4 curves of the adult vertebrae column, which 2 are primary and which 2 are secondary. So, if I can show you here. So we have the clavicle is the first 7, and then we have the thorax, which is the next few, and then we have the lumbar, and then we have the pelvic area. The primaries are the thorax and the pelvic area, and then the secondary are the cervical and the lumbar system.